In England, there were over 71,000 gonorrhea diagnoses in a single year. Yet, on the actual day of infection, there's almost never a warning sign. People usually don't seek answers because of a sudden physical feeling. The realization often starts with a circumstantial event: a broken condom, the start of a new relationship, or an unexpected text message. This timeline spans 1 to 14 days after exposure, the incubation period for Neisseria gonorrhoea. Here, the bacteria multiplies undetected. You may feel perfectly healthy and carry on as normal. But feeling fine is not a negative test result. Because the body's natural warning systems are delayed, or in many cases never turn on at all, waiting to feel sick is a failing strategy for managing your sexual health. To understand how this infection operates, we have to look at what the bacteria needs to survive. It thrives in warm, damp environments. This maps the bacteria's primary targets, the cervix and the urethra. Expanding the map for oral or anal contact reveals secondary, hidden colonies in the throat and rectum. These infections are almost universally asymptomatic. Without discomfort to drive clinic visits, they become silent reservoirs. If we only think of gonorrhea as a strictly genital infection with obvious warning signs, we give the bacteria the perfect cover to hide in plain sight and spread silently through varied sexual contact. After incubation, the patient's experience splits down two unreliable paths. First, physical signs may appear: burning, discharge, or pelvic pain, but these overlap with routine issues like UTIs or thrush. The second route is entirely silent, allowing a person to unknowingly pass the bacteria. If ignored, both paths lead to the same destination. Untreated gonorrhea can spread deep into the reproductive organs, causing severe pelvic inflammatory disease in women, painful prostate infections in men, and posing long-term risks to fertility. It does not matter whether your body sends you a confusing signal or no signal at all. The biological damage continues to progress at the exact same rate. Navigating this requires a shift in logic. Instead of trying to interpret every minor ache or relying on your body to sound an alarm, you have to base your health decisions entirely on context. Specific events should act as automatic triggers for a test: unprotected sex with a new partner, a condom slipping or breaking, or a partner's exposure notification. This is where clinical tools step in. This diagram breaks down a rapid lateral flow immunoassay swab test. Professional screening checks a specific biological sample, usually a cervical or urethral swab, for the gonorrhea antigen. If the test detects the antigen, it triggers a positive reaction. The next step is straightforward: secure clinical advice and start a course of antibiotics to clear the bacteria. However, a negative result means the antigen wasn't detected in that specific sample. It rules out the infection at the site of the swab, but it doesn't automatically clear hidden infections in the throat or rectum, which is why testing the correct areas based on your sexual history is vital. A positive result is not a judgment of character. It does not mean you have done something wrong. It is purely a biological reality that requires a practical, standard medical response. By looking honestly at your exposure history and utilizing early testing, you replace anxiety and guesswork with clinical clarity. It is the single most effective way to stop the silent spread